Back to our top story, where the Health Minister, Dr. Joe Phaahla, has said the condition of the victims of the Joburg fire at this stage is stable. He's, however, announced that 2 more people have passed on, bringing the death toll now to 76. He was addressing the media a short while ago after visiting patients at the Helen Joseph Hospital in Johannesburg. He says a large majority of the people had to jump from the 5-story building to escape the blaze. Now, reporter Moloko Moloto has been monitoring the visit, but now he's joining us from the Diepkloof Medical Forensic Laboratory as we continue to discuss the aftermath of this fire. Good afternoon again, Moloko. You are now in Soweto, having left Helen Joseph earlier where the minister was. We were told they were going to be heading to Diepkloof. That's where you find yourself.
That is very true, Braden. The Minister of Health, Dr. Joe Phaahla, along with the MEC of Health in Gauteng, Nomantungko Moralehoko, jointly briefed the media where he announced that the death toll has now risen to 76. For the longest time, the number had been standing at 74. This latest 2 people who succumbed to their injuries died in hospital. And the minister, when we asked as to what the condition of those who are still in hospital is like, he's saying, look, we really are not fearing that much that there could be more deaths. But of course, nothing can be guaranteed. And he did point out, Braden, that many of those are those who are jumping from that 5-story building, and as a result, they sustained injuries where they had broken limb, for instance, or leg, and in some instances, they inhaled smoke. Now, there is a big problem which he says they are now confronted with, Braden. But maybe before I talk about that, the issue that relates to the identification of the deceased, the minister did indicate that there's still about 33 or so people who are still in various hospitals here in the Gauteng province. The challenge that he says really poses a major conundrum for them as the authorities is the process of identifying the deceased. He is saying that up to so far, they, of course, have managed to identify only 12, or the rest are really, they have banned beyond recognition, and that is a process that will take a DNA test so that they can be cocksure that indeed they are linking the deceased with either families or the relatives. Now, the difficulty is that they want to have people come forward to identify the deceased. Their challenge, therefore, is that because some of these people are foreign nationals, the suspicion is that because some may not be in the country legally, we have seen some of them refusing, some of those who were affected by that fire but perhaps did not endure some injuries or sustain injuries, they were refusing to go to the shelter. So because they fear that they might be arrested and be deported. So that's really a challenge that they are faced with. But let's listen to Minister Joe Phaahla as he was briefing members of the media earlier on at the Helen Joseph Hospital in Johannesburg.
So the big problem, of course, as you know, which we are left with, is the fact that we've got 76 fatalities, out of which 74 were those who, as the reports have been given from yesterday, were demised, were demised on the premises, and then 2 passed away, already in hospital. Only 2 are those who demised in hospital.
Dr. Joe Phaahla, the Health Minister, they're ending that update for Moloko Moloto, who's of course part of our eNCA team that continues to monitor the aftermath of that deadly blaze in Johannesburg. Another reporter on the